we just got up to this slide where we're going to describe, body weight shifting during standing and during gait, and obviously different types of reactive responses, and what we can actually see, and what we can how we can customize our perturbations to actually initiate the reactions that we want to initiate in order to improve balance and gait. Okay, and general deficits and general, walking ability as well, obviously. Okay, so in this first slide, I have a patient with right side hemiparesis. And what we're actually doing here is we're laterally moving the treadmill to the left. Okay, now he's got right side hemiparesis. Okay, when we move that treadmill over to the left, what happens is the body moves and there is a delayed, if you like, movement of the center of mass on the right hand side. So the patient has to, or the client has to, do a reactive step in order to, if you like, redefine a new base of support. Okay, because the center of mass is over the right hand side, and he has to do this crossover step in order to redefine a new base of support. Okay, do you have any comments on how to better describe that at all, Amy, of what's actually happening in that right hand pane?
Yeah, I think that's exactly what's happening. I appreciate the fact that we can very specifically target a muscle group to coordinate his efforts in trying to take that stepping response. So I am impressed by the way he can actually take a step with his right foot. But it's more that video on the left where he has to go, his stance phase, he's just standing on that right leg that it appears unstable. So it just shows how we can, where his deficits are, even with a small perturbation, but we can control that. And I like that. It's great.
Yeah. So we're forcing that weight transfer to the right hand side. And this is the question about, if you like, or what we can actually see visually is he wouldn't usually do that. He wouldn't train it. He wouldn't be working to that limit at all. But if you force him to do it, because it's the reactive response which is forcing him to do it, then he's practicing that. So we want to increase the amount of time that he has in that right stance phase, or right single foot stance phase. So if that's our objective, we saw that during while we were looking at the gait analysis, and we see this while we're moving the treadmill, then we can just repeat it, over and over again, because we're doing that. And at the same time, we have this rush, sensory integration rush, if you like, of proprioception information, of head movement information coming through, and then at the same time, as I said, we have to suddenly contract the muscles, activate the muscles in the right leg in order to actually hold that weight. So we're doing a very quick contraction and a very speedy contraction, and that's what we were talking about type 1 fibers firing rather than type 2 fibers firing. So
correct.
There's a lot going on, but if we can fit that a lot going on with our objectives, then that's how we can aid the patient in his recovery. Correct? So
right, and the fact that it can be repetitive, so we can repeat that same perturbation and elicit the same response, if not perhaps a little bit better over time. So that's exciting too, is that a lot of times as therapists, we want to go ahead and go forward and backwards right away, or anterior, posterior. However, this man clearly needs work on that right stance leg, so to speak. It's great.
That's right. That's right. So yeah, those points are very, 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 very welcome. The fact that once you've found that customized level, you can repeat it exactly at that customized level. So it's like you found an objective customized level, an objective amount of perturbation, and you can repeat that objective intensity of perturbation. So exactly. That's like a reliability of giving a certain amount of perturbation, sort of thing.
Right.
Yeah.
And the fact that there's carryover to real life. So if he were to, you know, by accident walk down a sidewalk and trip a little bit, you know, that over time should kick in, that he can take a step and he knows he's comfortable because he's done it before.
That's
So,
right.
so yes, that's excellent. And I love finding that threshold. I love finding that threshold that they can tolerate, because it's very therapeutic to work at that level. So of perturbation.
Okay.
Nice.
And now if we have a look at the right hand pane, we're doing the opposite here. So we're perturbating to the right, to the patient's right. So what's happening here is, again, the body initially moves to the right with the treadmill. There's a delayed movement of the center of mass. So the center of mass falls outside his base of support on the left-hand side. And that forces him to take this crossover step to the left-hand side, to his left-hand side. So he's activating, if you like, more of a forward flexion of the hip, correct? Do we see any knee activation at all when he does that? A little bit, yeah.
Absolutely. Mm-hmm. Yeah, I
Do
see it.
do we
Great.
see any dorsiflexion? We see some of that as well, correct? So again, we see the beginnings of movement where he has deficits, okay, because it's a reactive response. And again, it's not going to be those type of movements that he would do if we told him, you know, try and take a step forward now as much as you can with your right foot, or try and do that crossover step. If we ask him to do that voluntarily, we probably wouldn't be seeing that, okay? But if we can force him to do it, then we can actually initiate or elicit that response, if we like. Okay, so good. Okay, and now we're doing the same with these slides on walking. Okay, so do you want to walk me through what you can actually see on the left hand slide pane?
So here we have him walking. You can see how he's looking down at the treadmill because at this point in his rehab, he's relying a lot on his vision to assist him with his balance. However, when you apply a small perturbation with walking, you can see that he is also trying to react a little differently than he did when it was stationary, such as you don't see the crossover, but you definitely see him use that right leg, if we're looking at that left side, to stabilize more so he can put weight on it and take a step to the left.
That one there, yeah.
Yeah, on that one there. Mm-hmm. So it takes a definite coordinated movement pattern to be able to tolerate that. And that's just a progression of what we just saw on the last slide of him standing still and trying to take a step to the side or try to maintain his balance.
That's right. Something quite interesting, and we can discuss this because it just came through my mind, is that it's actually a series of reactive steps, okay, isn't it really? There's a first, second, third, and that's exactly when I think we showed that CCTV image of when that patient had a collision, that the first step wasn't good enough, and he's only got a finite amount of time to attempt the second step or to attempt the third step, and then he's on the floor. Correct. So here you're training him to, as quick as possible, to attempt the second and a third step. So that's something that's just come through my mind.
No, it's very true, because not all patients will always cross over, as we see right here. And it's because of weakness. We have some, you know, as we said, he has hemiparesis to some extent. I don't know the patient well to know if he had any neglect early on or if they're still there, but he sure is working it very well, that he's still maintaining his balance and he's figuring it out in a safe environment. And I enjoy that threshold of that perturbation, because you can see him try to weight bear more on that right leg. He takes a little step and then he'll take a bigger step as he has to reach with that left leg over to maintain his balance.
Uh,
So it's not only strengthening that right leg, but it's training the brain that he can stay up and not fall. He's figuring out his own type of, I guess you would say, compensatory strategy to stay up.
Do you think there's anything going on here about when you're doing a crossover step, you're actually shifting your body weight over your own midline?
Yeah, so you can see that he has a little bit of difficulty getting over to that right leg, or crossing over with the left leg. It depends on how you look at it. When the perturbation's given, as you can see here, he wants to take little steps to just, whoop, there you go, maintain that balance. So it's really kind of fascinating, actually. I believe, obviously, I'm not sure, you would have to help me with that, if he's in the middle of his rehab.
No, he's definitely chronic here. That he's a patient now. He's about 4 years post event. Okay, so it's not he comes, if you like, for little top-up sessions, of 10 sort of top-up sessions, that sort of thing. So yeah, so it's really chronic here. Okay, right. So now here, this slide here, we're actually seeing the perturbations again in the standing position, but if we're looking at the left-hand slide or pane, we're having this movement of the treadmill forward. Okay, so again, we can understand this again. The body moves forward with the treadmill. The center of mass is delayed movement relative to the body, so it falls outside the center of the base of support, and he has to take that step in order to realign or to remake a new base of support. Okay, and that results in a step backwards. As well as I said before in some of the earlier slides, if you decrease the intensity of perturbation, it might very well be that his reactive response, that ankle flexion, may be enough for it to give to set up a reactive ground force to push that center of mass forward back within his original base of support, which is that double foot stance. Yeah. But as you increase that intensity of perturbation, then he's really going to take that step backwards.
Yes, and in clinically, sometimes in these types of patients, it's hard to strengthen the hamstrings in a functional manner. So just by him taking that step backwards, you can see how he is flexing his knee and he's putting his toe down, then his heel, and then stepping on it, and then initiating a stance position or completing a stance position. So, when you look at this type of rehab, you have to take into account, not only are we training reflexes, and we're obviously getting the ankle and hip synergy to activate, but we're also strengthening some muscles here, which are hard to strengthen in the clinic functionally. So this is a great perturbation training for him.
That's correct. That's correct. Now, we can also mix this with instructions. You quite rightly pointed out with on that left-hand pane, the way that he is using that hemiperitic leg to actually contract and take the weight as he's moving his left leg back. Now, we can actually do that with instructions by actually telling him to put weight on different legs. So, for instance, if I told him to actually load up the left leg, then I could force him to take a step backwards with the right leg. Okay, and that would be working on hip flexion, hip extension to actually take that leg backwards. Okay, so that could be, you know, one of our goals. Okay, so what I'm trying to point out is by mixing up instructions with perturbations, again, we can elicit what, you know, the response that we want to formulate.
Correct. Yep.
Okay. Okay, and here we're seeing those same accelerations backwards and forwards, or of the treadmills backwards and of the treadmills forward, as we're doing it during gait. Okay. Okay. Now, one thing to point out here is, well, there's a couple of things that that just came through my mind here. The first thing is, if we want to increase stance or step length, then obviously by giving a perturbation forward, we can then, and depending on which leg is in the swing phase, we can then increase the step length of the leg which is in the swing phase. Okay, and that's going to increase the amount of time that the patient is on the load bearing leg. Okay.
Correct. Then there's also a program on the BalanceTutor that allows you to give a perturbation when you're on a stance leg. So you can flip right or left.
That's right. That's right.
For a little bit, and that's also excellent training.
So in conclusion, so we're encouraging different body weight strategies. Okay, we can improve crossover steps. We can work on initiating step initiation as well, obviously, and we're all the time working on sensory integration. So I think that's a good conclusion.